Hi, my name is Sharlene Dean. I'm the practice manager for the Prevent Clinic, and we are live today in Austin, Texas at the Texas Nurse Practitioner Conference. And I wanted to introduce Gina Pritchard, who is our very own nurse practitioner who is an expert in cardiovascular disease, the prevention of cardiovascular disease. And Gina, I wanted to just ask you, for everyone, and even I get asked this question often, is what is a simple, quick test that I could do to tell if I have cardiovascular disease?
It's an excellent question, Charlene, and we do get asked this question often when we aren't at conferences like this, but we have certainly gotten the question, and it's the main reason that we're here really, is we have come to empower nurse practitioners who are wanting to implement this life-saving technique, the Bale-Donine method, into their practice. We want to provide the support and the resources to nurse practitioners in order to do that, to bring this life-saving information to more people, this life-saving testing. But as is always the case, besides nurse practitioners interested in implementing this in their practice, we have seen several nurse practitioners and had great conversations during this conference of nurse practitioners wanting this information personally for their own life or for the lives of their loved ones who have either had a bypass surgery or had a heart attack or stroke or wonder about their risk of cardiovascular disease. So there are several tests that are very important that you need to know in order to truly understand what is your risk of having a heart attack or stroke. The Bale-Donine method, as Charlene alluded to, is a very powerful prevention method, and the first two steps in the method are education, and secondly, testing to understand disease. In other words, if you're a person who hasn't had a cardiovascular event, meaning heart attack or stroke, and you don't know if you have atherosclerosis or plaque buildup in the arteries, then you need a test to find out why. That is the place to start before any other testing. What is the current state of your arterial health? If there's a little bit of buildup of plaque in the artery walls, any artery in your body, whether it's the carotid arteries that give the blood supply to the brain, the femoral arteries that give the blood supply to the legs, the aorta, any artery in your body, there's calcium buildup. If there's a small amount of plaque in there, then your risk of having a heart attack or stroke in the next 10 years is much greater. In fact, 40% likely to have an event in the next 10 years than someone who has no plaque at all. Plaque, when it starts to build up in your arteries, isn't symptomatic, meaning you don't feel it, but it can be lurking, it can be harboring there, it can be building up in the artery wall. And we can give you hope, because if it's there, whether it's a small amount or a large amount, that is the power of the Bale-Donine method. The next step is to identify the root causes and reverse and optimally manage all of those root causes contributing to the disease before you have a catastrophic event. So the first test we start with is either a coronary artery calcium score called the cardiac scan or the CT. As I mentioned, it looks for calcium in the heart arteries. And then the second test, or it's actually not the second test, but one of two we have to choose from that are simple, easy to implement, easy to have done, and becoming relatively inexpensive. $65 to $300 are the range for either one of these non-invasive screening tests. So the next is an ultrasound-based test. Some people call it the artery age test or arterial age test. Some people call it the CIMT, carotid intermediate thickness test. But it's an ultrasound, regular sonogram, where we look at first the carotid arteries in the neck, then we might move to the femoral arteries if we don't see anything there. We want to get a good understanding of what are the walls of your arteries look like. Thickened, a little bit of plaque, or very healthy. And then we know your baseline and we know what your risk is and we know where to go from there. So nurse practitioners are the leaders in this movement, this heart attack and stroke prevention movement. There's much excitement here at this conference and much interest in those that need to implement these tests more often and begin implementing these tests into their practices. So the title of this conference, Transforming Healthcare in Texas, we're seeing that happen with nurse practitioners leading the charge, not only here, Charlene, but in the rest of the United States and in a few places in the rest of the world. So it's definitely a powerful movement, and this test is where you want to start, whether you're a patient or a nurse practitioner. If you are a patient, call Charlene at 972-672-9131 to get more information, or go to our website, www.thepreventclinic.com. And if you're a nurse practitioner needing more help in this area, I feel so passionate about it that is what I've designed my doctoral project around. So I am going to graduate in May with my doctorate degree, and I'm going to the prestigious Belmont University in Nashville, Tennessee. And that's allowed me to design this project and bring it to a much wider nurse practitioner audience. So I would love it, nurse practitioners, if you would text the word HEART, HEART, to the phone number 972-600-2048. Nurse practitioners, calling all nurse practitioners, whatever your area of specialty, this will give you an educational module that will provide valuable information to you about these tests and more support to implement this and to educate your patients as well. Thank you for watching this video.
Gina, thank you for your time today.
Yes.
I appreciate it. Thank you.
Yes.